For those of you who are working on that in-basket that you are not loving, that you are hating the in-basket, remember to check out backlogbuddies.com, which is a co-working virtual platform where you can come and do your inbox and backlog work alongside other physicians and clinicians. This is your space to get your inbox done with friends. We know that backlog is boring. Backlog takes a lot of effort to overcome procrastination. It's not the fun part. And all of the physicians and clinicians who come into my world arrive with a backlog. And we know that some weeks we have big weeks and we have a little left over. So if you are looking for the perfect place to get your work done, check out Backlog Buddies. Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hello, and welcome back, everybody. It's super excited to have you here. Today we have with us Dr. Toya Luces-Sampson, and she's going to be telling us all about herself and her journey through medicine. Welcome.
Thank you. I'm so happy to be here.
Excellent. Tell us about you. So tell us about your journey through medicine, what you do now.
Yeah, so I am Toya Luces-Sampson, also known as Dr. Toya, and I was born in Trinidad and Tobago, which is in the Caribbean, and went to undergrad, medical school, everything here in the US, trained in obstetrics and gynecology in Pennsylvania Hospital in Philadelphia, and then started my attending practice out in California on a whim. I was like, you know what? I'm going to go to California. And I was told that I would never find a husband, but I came and found one. And in my first job, I just felt really not supported, didn't have the kind of mentorship that I wanted to be the type of surgeon that I wanted to be. So
Mm-hmm.
I left for a larger system that was corporate medicine.
Mm-hmm.
And everything that comes with corporate medicine is what burned me out the second time, because the first time was residency. And
Mm-hmm.
it was during that journey when I was really in survival mode. I
Mm-hmm.
had what the definition of golden handcuffs are at that job. So I really thought I just had to push through. I just had to survive. And I decided to start a business during COVID, like many people. And it was the lessons of entrepreneurship that really liberated me from that burnout and gave me the confidence to step outside of what is normal and accepted in medicine and realize my value as a physician. And that's what gave me the courage to quit that job and to just have a vague idea that maybe I would do locums. I didn't really have a plan. And I just knew that I would be okay because as physicians, we are so highly trained. Our skills are transferable. We can do so many things. So I took a leap and had doing locums ever since. And I very recently retired from clinical medicine, like a couple months ago.
Yeah.
As I fully transition into coaching, which is what I do now. I coach
Mm-hmm.
physician moms, helping them navigate medicine and motherhood without martyrdom. And it is truly like a second calling to me. And I've used everything, all of my experiences, all of the burnout, the entrepreneurship, everything to be the coach that I am right now and to help these women, my colleagues, so that they can stay in medicine if that's what they want. They can leave medicine if that's what they want. They can find their balance, all of the
Mm-hmm.
things. So that's me.
There we go. Perfect. So let's go back then to residency and your first experience of burnout. Tell us more
Mhm.
about that.
Yes. I always say it was the best and worst 4 years of my life
Mm-hmm.
because I was so well trained. My program was excellent. I will ever be forever grateful for the training that I got there, but it was just not a great place for me. I was made to feel that my personality, like who I was not okay. Like I was painted as a very mean person, and the nurses didn't like me, and all of these things. But nobody had a question about my work, so it was like this dichotomy of all of these complaints and things, but everybody wants me there when stuff hits the fan because I'm a hard worker, excellent work, excellent hands, all of these things. So navigating that and having to deal with what I now know is not really being able to speak to people and not knowing how to process my own emotions because I was very intelligent. I knew, top of my class and all these things. And I came into an environment where I didn't know stuff. Like you don't know things when you come in as an intern. And I didn't deal with not being right well.
Mhm.
And it was a lot of internalized, beating myself up and a little bit of perfectionism. And I didn't know how to deal with that. So people saw me being silent and my unhappy looks and angry stares as being outwardly not a nice person when I was really beating myself up for not, not being an attending level as an intern, right? So
Mhm.
it was very difficult navigating that. And there was things up with racism and all of those things wrapped into one. Um, my program director really saw my leadership potential and used that a lot to his advantage, but at the same time, there was no recognition. So there were a lot of different things that just led to it not being a pleasant experience. And the peak of it was, when I was walking to the hospital, because I live very close, and I was crossing the street, and I just remember thinking, if a car was to just hit me right now, it would be okay. Like I don't want to die. I just want to get hurt enough that I do not have to go into that place. And
Mm.
I remember I used to have this playlist as I walked to the hospital just to get me there because I just did not want to be there. And I told myself when I graduated I would never be that unhappy again
Mhm.
because now I had choices, right? So that was the residency experience.
Okay. So being perceived as mean, how did you know that that's what they thought of you?
Well, they were very vocal about it.
Vocal about who was vocal about
Yeah.
it?
The nurses mainly,
Okay.
and some of the co-residents as well.
Okay.
Um, yeah, so it was not a secret, right? And
Yeah.
it was like there was comparison with my co-residents as well.
Okay.
Because in general, I seem happy now, but at that time I was not this bubbly
Oh
person.
no, I
You
can
know,
appreciate that to have to use a playlist just to get you to walk
yeah,
across the road and not get hit by traffic to be able to
yeah,
turn up your next shift. That shows me someone who's suffering. Did
yeah.
anyone know how much this was hurting you? Did anyone see that with you?
I
Walk.
think people knew I was unhappy,
Mm-hmm.
but that was the extent of it. It was almost like this is what is expected. Residency is hard.
Mm-hmm.
And yeah,
Okay.
I actually, I coach one of my old co-residents. She was under me. And I actually said to her in the group, I don't know if you knew how unhappy I was. And she was like, yes. So, people knew, but I don't know
Mm-hmm.
if anybody had the tools at that time because this was like over 10 years ago. Nobody
Mm-hmm.
was really thinking about resident
Yeah.
burnout and, what we were going through at that time. It wasn't really, it's just like, suck it up.
Got it. Other than your playlist, what else were you doing then to survive, to be able to go in day after day and not lose yourself completely to this?
Travel. So even
Travel.
though I did not have a lot of money, obviously as a resident, I still it's a passion of mine. I made sure that it was something that I continued to do however I could do it. So
Mhm.
I decided to do an elective in Botswana. So that took me to the continent for the first time, and it was absolutely amazing. I spent a month there. I did a solo trip to South Africa and a couple other
Mhm.
countries. Like I just did what I had to do to take care of myself and to make sure that I would survive.
What was the experience like doing elective in Botswana compared to working as a resident in the US?
It was an education. It was, so I'm from Trinidad, so I know what developing world medicine looks like. And it actually reminded me a lot of Trinidad, but maybe many, many years ago. So we were a little bit more developed,
Mm-hmm.
but it was just interesting to see the differences in care and the things that we would have to do. So I mainly was in a see and treat clinic for colposcopies, right?
Mm-hmm.
So if anything looked abnormal, they would get a leap. Like we were, removing cervices left and right. And it was
Mm-hmm.
just such a shock that that is the way that they practice there, but it was what was necessary for that population. It was the safest thing. So
Mm-hmm.
it was very interesting and it was a great experience. I just loved that experience.
Were you unhappy there and considered mean?
No, it was
Okay.
great. And
Okay.
it because residency actually ruined my birthday for me. I
Uh-huh.
had a very negative experience on my birthday in my second year, and I went to the selective in my third year. It is what made me realize that I would never work on my birthday again because it was
Mm-hmm.
such a beautiful experience. There were a lot of other residents there as well, and they all took me out, and it was nice being in Africa. I felt very connected to Botswana. People thought I was Botswana, and it was it was such a beautiful experience. And no, I did not have that problem.
So interesting the contrast because you're saying in the US I had racism, I was considered mean, I was very sad, I was very lonely, and then in Botswana I'm like I'm accepted, I'm having fun, I'm doing really hard medicine here too, but I am not the same unhappy person that I am at home.
Yeah, that is,
Interesting.
I've never summed it up quite like that, but yeah, that's exactly what it is. What
Yeah.
it was.
Okay. So you hadn't lost yourself. You were still able to enjoy your travel and the experience of being in a different place. So then you moved, and the next place you landed wasn't good either
It
because you wanted to
was,
leave it
yeah,
eventually.
it was good in some respects, but
Mm-hmm.
it just wasn't the best for me. So I knew I wanted to go to a place where the volume was still high because I
Mm-hmm.
wanted to keep up the skills of this high volume place that I trained at. And it definitely fulfilled that requirement. It was just not GYN heavy, and I really enjoyed GYN surgery. And the mentorship wasn't there. I was operating with um, PAs who didn't really do a lot of straight stick laparoscopy, so I
Mm-hmm.
didn't have that support. And
Mm-hmm.
I wasn't at the point in my career where I didn't need the support. So
Mm-hmm.
it was mainly because of that and lack of resources because it
Mm-hmm.
was a federally qualified health center. So they didn't have a lot of resources.
Mm-hmm.
So it just wasn't the right place for me to continue to grow to be the kind of physician that I wanted to be.
Okay, yeah. What was it like day to day with the staff? Were you having those similar issues with regards to unhappiness or
No,
racism, that type of thing?
no,
No.
no. I
Okay.
mean, the way that I am at work is that I'm not there to make friends, right? I am friendly. I'm very respect is a big thing for me, but this is not party time. Like I don't really share my personal life and things, and I feel very strongly about that.
Mm-hmm.
Um, you know, I people in general earn my personal life, like being
Mm-hmm.
privy to that. And I think lines are blurred when there's oversharing and things like that. So if somebody is turned off by that, then sure, they're not going to appreciate, not having somebody who's talking and laughing and telling them about their boyfriend.
Mm-hmm.
But for the work, I was very efficient always. I was
Mm-hmm.
a very good doctor, and most of my patients were Spanish speaking. I spoke Spanish. So all of the medical assistants, they loved me. They loved working with me because we got through all the patients on time. I didn't need them to translate most of the time. So the things that really mattered
Mm-hmm.
to them. So it was, they knew they were not coming over to my house, but
Mm-hmm.
they knew when they saw me, it was like, this is great. Dr. Luces is here.
Okay. Got it. Got
Yeah.
it. Okay. So that decision to move into corporate medicine now. So tell us a little bit of that decision-making process? How did that happen?
Yes. So I drove past the building once because I had moved to a different place to move in with my now husband. And I was like, I'm going to work there someday,
Mm,
because I knew that I would have more support and more resources. And
mhm,
I made sure that I spoke to people who had made the switch as well, because two people that worked at my hospital had transitioned from private practice to this corporate medical system. So I called them and asked them about how it was. And he was very honest and told me, this is corporate medicine. He described it as a big ship. Like, you can't turn a big ship. You just have to go along with wherever it's going, and you decide, do you want to jump off, or are you continuing to go where they're heading? And I always will be grateful to him for that gift,
mhm,
because he was right. And I felt like I went in with my eyes open, and it made it a little bit better, right? Because I knew what I had to do when I got there. So it just made sense for me at the time to make this switch. And so I did.
mhm. Okay. And then tell us your experience there, because you said that also burnt you out.
So in the beginning, it was fine. And,
Mhm,
we were very well paid and had amazing benefits. So the hard work just seemed worth it. But because of where I live in California, in general, it is hard to staff these offices. So we were always understaffed.
mhm,
And the management, it's corporate medicine. So there's a revolving door. So there was a lot of call, a lot of stress. The office management was not the best. And that was
mhm,
my biggest issue,
mhm,
um, because the office manager didn't like me. And with that came everything back from residency. It was like residency again, which is
mhm,
something that they told me when I started as well. It
mhm,
was like, this is like residency, the type of oversight,
mhm.
and the, big brother
Yeah,
feeling.
yeah,
So that was difficult to navigate. And that is what kind of pushed me to say that, this is not going to work anymore, just because I didn't have that support in the office. And
okay.
that's what happened. When I realized I had to make a change, I was driving home from the office, and I was like, if somebody rear-ended me, that would be okay. I don't want to die. I
Yeah.
just don't want to have to go into that place. And I said,
Mm.
Latoya, you said you would never be this unhappy again. Something
Mhm,
has to change. And because I had already been in my business coaching program for so long, and I knew I would be okay, I was able
mhm.
to make the leap.
Tell me about that, relationship with the office management. If there's any specifics about it that really, even now, create that, what was it about that relationship? What was it that you're asking for that you weren't able to get? Or what was it about their supervision of you that just felt so suffocating? What
Yeah.
specifics, if there is any, just to help us understand that a little
Yes.
better?
Lots of specifics. And I will start with saying that the way that medical system works, it is very difficult to fire people in, like, MAs and nurses and things, because they have a union.
Mhm,
So she's not fired, but she has been demoted, and somebody else is doing her job, and she's just existing. So that's to tell you, it wasn't a me problem.
yeah,
It was definitely a her problem. So because of the MA union and things like that, the way that the MEs were trained and remediated if they were a problem, it was more like, well, just kind of deal with it. So I
mhm,
had a lot of issues with the medical assistants, where they were just not helpful. They gave me a lot of medical assistants that had issues, and
mhm,
to the point where we were in a meeting for their remediation, and I said, she doesn't take feedback well. I can't remember exactly what I said.
mhm,
And the manager was like, oh yeah, she had that issue in her training as well. So these were known things,
mhm.
but because of the union, they were just moved around a little bit. We were not prioritized as physicians, was the short answer.
Mhm. Okay, so you'd asked that we cooperate on this, we do this as part of our workflow of the day, and you were met with obstruction and you weren't met with support from practice management about the constant obstacles of we're just not able to get on the same page with what we're doing in the day.
Yeah, and lots of emails and lots of meetings and, just met with, well, did you meet with them? It was just put on us as the physicians to
Mm-hmm,
rectify a problem that was above us, that was beyond what what our jobs were,
mm-hmm,
because we had a lot of things to do for our patients because it was an HMO. We had to do everything for our patients in that one visit. That was the expectation.
mm-hmm,
And training a medical assistant, remediating a medical assistant was also added on, or just dealing with it.
mm-hmm. And did you feel like you got any skill training around how to do that with an MA within that corporation? Were there resources to help you do that? No.
They had resources, but they it was like a sheet of paper. Like, go over this checklist with them at the beginning of your shift, and then that was it. So it was a hollow thing that wasn't
Yeah,
very effective, especially when there were problems that were beyond, systems.
yeah, yeah. Okay, all right. So lack of training, can't get that team working cohesively, no support from management, also personality dislikes, which from a leadership point of view is not going to be working towards a team that works well and collaborates together. You're feeling like if someone rear ends me, I'm going to be delighted. I won't have to go to work today. Then what? What did you do?
I started a business. It was
Mm,
called By Default. It was a directory of Black-owned businesses and Black professionals who cater to the Black community. And in creating that business and growing it, I sort of remembered that being a physician is actually a pretty big deal,
mm-hmm,
and that we have a lot of respect in the community outside of medicine. We have a
mm-hmm,
lot of skills that the training and practicing medicine give us that are transferable. I rediscovered my love of teaching, which residency beat out of me because I've always loved teaching.
yeah,
Um, and it liberated me. It helped me see that as a physician, I could always make money. This is not talking about job security in the purest sense, because, with COVID, yes, doctors were losing their jobs and things like that. But because I am so highly skilled, so highly trained, so highly educated, and there's so much respect that comes with being a physician, we
mm-hmm,
have so many things available to us. And in the realization of that, it gave me everything I needed, the courage to say, yeah, I'm not doing this anymore. And I was about to buy my shares to be a shareholder. And I was like, nope, I'm just going to leave instead.
mm-hmm. Interesting. Okay.
Mm.
You mentioned efficiency and that you have a skill set in medicine that was then somewhat transferable to business, and then you've used that further to help in the personal realm. So tell us more about that.
Yes. So I'm the type of person where I use every situation that I've been through to grow and evolve and help me moving on. So I've always been more efficient. I love systems.
Mm-hmm.
They make me happy. They get me, they get me through things, and that's how I navigated having all of those patients in the health center and then at the corporate medicine place as well, because I love templates. I, love all of those things that just make things go by quicker. And I truly believe that investing in the beginning is going to help you. So I would stay back late and set up my templates and, do all of those things. And it's what I use in my personal life now that I have young children, and is
Mm-hmm.
what I use with my coaching clients as well.
Yeah. Can you give us an example of some of that efficiency within the clinical day? What sort of things were you doing that would help you get through your day in a more efficiently done way?
Yeah, so having the templates was the biggest thing for me. I left office practice before AI, but I'm a
Mm-hmm.
heavy AI user. So I would
Mm-hmm.
imagine if I was still in office practice, that would be the other thing. So
Mm-hmm.
I would dictate when I was there. I didn't
Mm-hmm.
type anything. So the addition of the templates and the dictating made note writing fly. Like I almost never had notes left over.
Mm-hmm.
And when inbox messages would come in, I deal with them right away. I feel like
Mm-hmm.
leaving them to pile up is just going to be overwhelming. And it
Mm-hmm.
ends up being, something that piles up and then you have them days and days later. So even in residency, when I went into a room with a patient, I trained myself to not need anybody else.
Mm-hmm.
So I would make sure that things were set up and that I could do my exams and things in the most efficient way, having everything set out for me beforehand. And
Mm-hmm.
because of my MA challenges, it helped that I trained I trained that way. So if they were not available, all of my things were set. So really just being as prepared as possible
Mm-hmm.
and using the support that I did have was, how I made it through.
Got it. Okay, beautiful. When did you dictate? Right, straight after the room, back in your office, after you'd finished the morning session? Like, tell us more about the dictating process for you personally.
Yeah, right after. So I did type in the room. So I would tell
Mm-hmm.
my patients, so it's not like, those doctors that come in and they're looking at the screen and not looking at the patients. I actually love the patient encounter. So I would connect and look at them and, get the history. But I would say, I'm just going to turn a little bit and I'm going to type for the
Mm-hmm.
really routine things when I would be reviewing, the old history and all of that. I would let them know what I'm doing. So a lot of it was done in the room, but then right afterwards, I very rarely didn't close a note quickly after. So everything was happening right then.
Mm-hmm. Yeah. What about when the MA came down the corridor and said, "Hey, your next patient, I did this urine on her, and this is what I found, and her blood pressure is a bit high, but you haven't finished your dictation yet." How would you navigate that?
So it's all about triage, right? So it's assessing, is this truly an emergency? Because
Mm-hmm.
they'll tell you all sorts of things.
Mm-hmm.
So using the same medical skills that we have, you know, deciding, okay, am I going to stop what I'm doing to address this concern? Can it really not wait? Because I feel like a lot of times we act on things immediately because it's like, this is an emergency. And most of the times it can wait for the 5 minutes for the dictation to be finished,
Mm-hmm.
especially if you have the template, you've already done some of the notes, just finish. And that's how I would usually navigate that.
Yeah. Would you say to the MAs, "Hey, if I'm dictating, you're just going to have to wait unless it's like a true emergency," or as they started talking, you'd give them a hand signal? What do you think would be the approach?
Well, they usually we had to keep our office door open.
Yeah.
They would usually just come in and start talking. So
Yeah.
we would have to, that was part of the problem, unfortunately. So I
Yeah.
would pause and, listen. It was a dragon dictation, so it wasn't like the phone where somebody was listening or anything like that. So it would
Mm-hmm.
be a pause to listen. If I'm really in the middle of something, I'd ask them to wait.
Mm-hmm. Okay. Okay.
Yeah.
Got it. Perfect. Now, tell us about in the home. How were you looking after yourself as a practicing doctor? You've got young kids at home. You're in the corporate world, I guess, at that point. So
Yeah.
it's a ship that you can't move. You got to deal with whatever you're dealing with. Tell us how you may have navigated some of these efficiency practices at home.
Lots and lots of support. I couldn't do it without lots and lots of support because my husband at that time was a full-time student. Part of the time he was in the military and then he left and was a student. And we had either grandparent or a nanny
Mm-hmm.
to help with handbooks and checklists and all sorts of the things that I love to, have my home running efficiently. And there was really no way to work how I did
Mm-hmm.
and survive without that. We had housekeepers that came, now they come more often because we have two. Just as much support as we could afford. because work was enough at that point.
Mm-hmm. Mm-hmm. And what did that do in terms of your ability to rest and recover from your busy weeks?
Oh, it facilitated that. I
Mm-hmm.
really could not have any time for myself or my husband. My marriage is very important to me. And I truly believe that as when you become a mother and a wife, the expectation is that you put everybody else first. But I
Mm-hmm.
truly believe that physicians and mothers in general should put themselves first, care for them, their marriages, and then for the children. So it was very important for us to have that. So having the support helped us do that. And even to the point where if we wanted to go on a trip without the children, we would fly my in-laws in to, take care of the children. People think we're crazy when we do that, but it's important to us, and our values are that we prioritize each other. So we live in alignment with that.
Got it. Yeah. Okay.
Mm.
Tell us what you do now with physicians. So some of the common themes that come up and some of the teachings that you do.
Yeah. So with my second, I had a very rough postpartum journey, and that really kind of broke me a little bit. I always say it's my third burnout situation because I was an entrepreneur. I had a full control of my schedule and I thought everything would be fine. But it was still that ingrained training from medicine that you must give of yourself completely. You must do all of the things. So I was speaking, I was caring for my newborn, I was not caring for myself. And I really just hit a wall. And coming out of that postpartum burnout and healing is when I decided I really want to avoid having other physician moms go through what I went through. So
Mm-hmm.
I started coaching and really just setting up systems and helping others advocate for themselves at work and at home so that they can feel fulfilled and be aligned with what is actually truly important to them. And if you want to stay in medicine, to do it in the most fulfilling way because we work so hard, right? So that's what I do now with private coaching, group coaching. I have a podcast as well, just spreading this message of we have done so much to get here as physicians and we deserve support and ease and, to not have to go through what I went through.
Very good. Very good. All right. When it comes to the burnout, what are you seeing now in terms of physicians within their environments? Is there anything that stood out, stories to be told about burnout and ways that we can be mitigating some of that?
Because of my niche, it's a very similar story. It's a lack of support.
Mm,
And this disregard, you know, it's like motherhood itself is completely disregarded within your field and your career. So you're expected to do all of these things at work, manage your MAs, take the call, do all of those things, and then go home and then wonder, well, if I have a nanny, does that mean I'm not raising my kids?
mm,
If I'm not cooking all the meals, does that mean I'm a bad mother? So there's this dichotomy and a lot of conflict
mm,
between, am I a good mother? Am I a good doctor? And really just not being able to advocate for oneself, just like I felt in my office. Like I just
mm,
felt like I had to take it. We just have to deal with whatever is given because we're lucky enough to have this job and to have these benefits. And that feeling that I also had of feeling that I need to deal with all of the burnout and the toxic environments because of the benefits, because of the loans, this obligation to just push through because, well, I don't have a choice. Right. So there's so many different things, but it's a common theme of I don't know how to do it all. I don't have support and I don't know what else I will do. Like I can't do anything else. I am trapped. So those are like the general themes.
Yeah. Tell us about your experience as a locum.
Yes, it was wonderful. It was so freeing, and it is what saved me, saved my medical career, because it gave me the freedom to choose when I practice and to choose where I practice and to get compensated at the level that I felt was appropriate for my level of skill. And that in and of itself also taught me a lot of lessons about entrepreneurship, because I now had to, I ran my locums company as a business, and it was very empowering to be able to practice medicine in that way. And I think it is a very viable option for a lot of people, but especially OBGYNs, who I feel like have the highest rate of burnout. I know every specialty probably says that. But it was very good for me at the time. And I think in general, in 2025, there's so many different ways to practice. So there's so many ways out of burnout, in my opinion. We just have to think outside the box.
What about working with new teams, new hospital environments, new surgical environments, and the politics that go with that? How did you navigate that as a locum?
It actually wasn't that bad, because because of how I was trained and because of the different environments I'd already been in, I was kind of adaptable at that point. And I was also so happy that you could deal with a lot more stuff when you are not burnt out, right? So there were definitely places where I was like, this is not safe to be here, right? Because a lot of the places that need locums, they need locums for a reason, right? People don't want to stay there and things like that. So I wouldn't say it was all rainbows and butterflies, but in general, I was very adaptable. And I'd been in enough situations where it wasn't as big a deal. And I think it also helped that I did it later on in my career, where I felt very confident in my skills, because you are often alone, right? But it was fine.
There you go. Good feedback. And where do people find you if they're looking to learn more or reach out or hear your podcast?
Yeah, so my podcast is called Stethoscopes and Strollers. It is on all podcast platforms and on YouTube as well. And we talk about my stories, other physician moms' stories, so that you can feel a little more seen and a lot less alone. And then everything else, my coaching, everything can be found on my website, drtoyacoaching.com. And that's DRTOYA coaching.com.
Perfect. Thank you so much for coming. Anything we didn't talk about that you'd like to leave our listeners with?
Yeah, whether you are a parent or not, I think it is important to allow yourself to be supported in whatever way that means for you, whether it is getting childcare or getting a housekeeper, using the AI systems at your hospital, using AI at home. We didn't talk a lot about that, but I'm a very big AI advocate. I know a lot of physicians are scared of it, but whatever it is, whatever it looks like, you deserve it. We have worked so hard to get where we are. Allow yourself to be supported.
Love that. Well, thank you so much for this conversation. Have a wonderful week, everybody. Bye for now. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.